All right. Hi, everyone. So my name is Andrew Lim. I'm a neurologist up at Sunnybrook. I see patients in my clinic who have sleep complaints, so difficulty falling asleep, staying asleep, problems with daytime sleepiness, and who may also have concerns about their memory. They may already have a memory disorder or may be worried about getting one. And my research program is largely focused on exactly this, the relationship between sleep and cognitive impairment. So I'm going to start off actually with a lightly fictionalized patient, but very typical of the sort of person who I might see in my clinic up at Sunnybrook. So this is Beatrice's story. So she's a 76-year-old woman who's had now 5 years of difficulty staying asleep at night, accompanied by excessive daytime sleepiness. And she's also had a year now of increasing difficulties with her memory. Okay, so she gets really tired during the day, especially after dinner. Some days she'll go to bed as early as 7 or 8 o'clock at night, but many days she forces herself to stay awake until 11 p.m. due to social commitments. She has a very busy life. She falls asleep very quickly at the beginning of the night, but wakes up a lot. So she wakes up 4 or 5 times a night, and then many mornings she'll wake up as early as 4 a.m., and she's just unable to get back to sleep, so she'll begin her day at that point. She also has been noted to snore a little bit as of late, and over the last year, she's had increasing memory difficulties, so forgetting where she placed her keys or forgetting what she had gone into a store to buy. So Beatrice has, for me, a number of questions. So she asked me, a lot of her friends have trouble with sleep as well, and she wonders whether there really is anything actually wrong with her sleep, or is this just a part of getting older? Beatrice asked, what's causing her sleep difficulties, and how can we figure this out? She's curious about her memory difficulties and whether they are at all related to her problems with sleep. And importantly, she asked, what can be done to improve her sleep, and whether improving her sleep might improve her memory and prevent dementia. So I'm going to go through each of these questions one by one. So her first question is whether her sleep really is abnormal at all. So I get this question a lot. So how much sleep do I actually need? What's a normal amount of sleep? And the answer is actually kind of more complicated than it seems. So you'll see a lot of stuff out there about needing 7 or 8 hours of sleep. And indeed, on average, many people do need about that much sleep. But the reality is some people need less and some people need more. So what I like to say is this: if you fall asleep easily and stay asleep for anywhere between 6 and 9 hours with no more than a couple of awakenings at night, and if you have no trouble staying awake all day long, even in sedentary situations, so you can watch TV, you can be in meetings, you can be a passenger on a long car ride, and you don't fall asleep, then your sleep is probably okay. But this, of course, is not the case with Beatrice here, who isn't able to sleep as long as she would like. She's probably sleeping only five hours a night, and she's waking up a ton at night and is sleepy during the day. So to answer Beatrice's question, her sleep does seem a little bit off for somebody her age. Whoops. Okay, this is actually question 2. So her second question is, what's causing her sleep difficulties and how can we figure this out? And there are bits to her story that suggest specific diagnoses. Her sleep timing suggests that there might be a misalignment of her body clock, and I'll talk a little bit about that. The history of snoring raises the question of something called sleep apnea, and I'll talk a bit about that. And as well, we know that as we get older, there are changes in our brain that make our sleep a little bit lighter and more fragmented, and that may be an issue as well. So let me talk a little bit about the body clock, these circadian rhythms. So within each of us, there's a 24-hour body clock that determines the timing of a whole sequence of body processes. And this body clock, which exists in a part of the brain called the suprachiasmatic nucleus, serves to time and align our bodily functions to the day-night cycle. This suprachiasmatic nucleus, in turn, receives input from the eye, so light is the main signal that tells our internal body clock what time of the day it is, and then it sends signals to other parts of the brain and body to synchronize them. Importantly, the suprachiasmatic nucleus sends signals to the rest of our brain that help us to stay awake during the day and help us to sleep at night. So you can see that during the daytime, there are wake-promoting signals, and during the nighttime, sleep-promoting signals. signals. In advanced sleep phase, which might be what Beatrice has, the master clock sends wake signals too early in the night. So rather than sending wake signals at 7 or 8 o'clock in the morning, Beatrice is getting wake promoting signals at 4 o'clock in the morning, causing her to wake up early. And then she gets sleep promoting signals too early as well, which is why she gets so awfully tired at 7 or 8 o'clock at night. Well, what causes this? Some of these things are environmental. So if you get too much light in the morning and insufficient light at night, it can make this more likely to happen. But genetics plays an important role, and so does age. So we know that the internal body clock, as we get older, advances a little bit with every succeeding year. So the other thing that Beatrice might have here is sleep apnea. So sleep apnea is a condition that's characterized by repeated collapse of the upper airway, resulting in restriction of breathing at night. So people breathe fine during the day, but then have snoring and restriction of breathing and sometimes stoppage of breathing at night. This leads to frequent nocturnal awakenings and low oxygen levels and excessive daytime sleepiness. Now, when we think about sleep apnea, we often think about kind of like overweight, middle-aged men, but the reality is that as we get older, and especially after menopause, more and more women actually get sleep apnea as well, and it's underdiagnosed in women because of these stereotypes that we have about what the typical sleep apnea patient looks like. In fact, it's present in up to a fifth or over a fifth of women over the age of 65. Now, the third factor that we think might be at play in Beatrice here is changes in brain circuitry that accompany aging. So just like there are parts of the brain that are responsible for vision or memory or movement or other things, there are parts of the brain that are responsible for keeping us awake during the day and for keeping us asleep at night. So there's an off switch for the brain that has to function to allow you to sleep. And we've done a little bit of work taking a look at this area. It's an area in an area of the brain called the hypothalamus, and it sends signals to the rest of the brain to shut off in sleep. And what we found is we studied a bunch of folks with wristwatch devices to measure their sleep when they were alive, and then when they passed away, they donated their brains. And we took a look at this region and found that the number of cells in this region was a predictor of how well people slept. So it's lower with age and lower yet again with Alzheimer's disease is the number of cells in this area. And the fewer cells you have, the more fragmented your sleep is. Okay. So how do we make a diagnosis of these things? So traditionally, you guys will maybe know that we would bring people into the sleep lab, right? So you come, you spend a night in the hospital or the sleep clinic, you get hooked up to like a ton of electrodes. It's kind of uncomfortable. You get a bunch of sensors placed on your face and your chest and everything else, and then we try and make a diagnosis. But of course, I mean, there are huge downsides to this, right? It's kind of uncomfortable for anybody who's ever been in one of these sleep labs, right? It's expensive. There aren't a lot of spaces, right? It requires specialized technicians and doctors and that sort of thing. And ultimately, what I like to say about these sleep labs is they're not really a measure of your sleep. It's a measure of how well you tolerate a sleep lab, right? So the people who sleep well in the sleep lab sleep well because they can tolerate a huge amount of discomfort. So a lot of work in our group is on using wearable sensors to ask the question, can we just replace this whole business with sensors so that people can sleep at home in the comfort of their own homes and make a diagnosis this way? So we work with EEG headbands, like the Muse headband. We work with these adhesive patches to try and diagnose sleep apnea. It's like a little smart Band-Aid that you can just put on your chest and diagnose sleep apnea that way. And we work with wristwatches as well. And a lot of the effort in my group is focused on applying AI to these signals, so that instead of going to a sleep lab and then waiting 2 weeks for somebody to analyze the results, you put on a little Band-Aid on your chest and you get the result the next day. Instead. So I think we can make a lot of progress in sleep diagnosis. So what about Beatrice's memory difficulties? So it does turn out that people with sleep disturbances like insomnia or sleep apnea do have a substantial increased risk of developing dementia later on in life. We've done a little bit of work in this regard. So we studied 700 people. We measured their sleep with wristwatch devices and then took a look at who developed dementia over time. And you can see the dark line here is people, this is the risk of dementia. The dark line here is people with really kind of fragmented sleep who wake up a lot at night. This is people with great sleep who wake up relatively little. And you can see that the people with really fragmented sleep at baseline have a higher risk of developing dementia over time. We have a lot of interest actually in our group in dementia prediction, and one of my students, one of the medical students, Julie, who works with me, has taken a look at these actigraphy recordings, these wristwatch recordings, and developed a AI-based model to try and predict who will develop dementia over time. And what she's found actually is that this model, if it predicts that you are unlikely to develop dementia over the sort of 6-year time span, you really are very unlikely to develop dementia, whereas people who have a certain pattern of sleep-wake activity, where the model says you're likely to develop dementia, do have not 100% risk, but obviously a substantially greater risk of developing dementia than those without this particular pattern on their wristwatch devices. Why does this happen? So this is like a huge area of focus in my research group, what sleep does to the brain that leads to dementia. I'm not going to go into this because there's a lot of technical details, but suffice it to say that we've shown in my group that people with disrupted sleep are more likely to develop amyloid plaques and neurofibrillary tangles, so the hallmarks of Alzheimer's disease. They're more likely to have a high burden of Lewy bodies, which is the pathology in Parkinson's disease. We've shown associations with brain blood flow and vascular health as well as brain atrophy and interestingly neuroinflammation. So we have some new data showing associations between disrupted sleep and more inflammation in the brain. Beatrice's final question is what can she do to improve her sleep, and will improving her sleep ultimately help her memory and prevent dementia? Now, there are some basic keys to healthy sleep that we should really all be doing, right? So some of the keys to healthy sleep are establishing a relaxing pre-sleep routine, keeping a quiet, dark sleep environment, not using the bed for anything other than sleep and sex. Like, don't do your work in bed. Like, don't sit there and doom scroll on your phone, in bed. Like, no TV, none of that stuff. And avoid, snacking in the middle of the night. It's a nasty habit and makes it really hard to get back to sleep. As important as what we do at night is what we do during the daytime, which is getting regular, moderate exercise, getting adequate outside time, and avoiding excessive napping. So this was like a huge issue actually during the pandemic. So during the pandemic, I had a ton of patients who, because of pandemic restrictions, just weren't getting out, right? They weren't exercising, they weren't doing the things they normally do, and that made a huge difference in people's sleep. A lot of people's sleep got worse in that context. And I think that, a really important message is that regularity is key, right? So you want to keep the same bedtime, you want to keep the same wake time, and you want to keep the same meal times every day. But sometimes that isn't enough, and I think in Beatrice's case, maybe that's the case. So she has circadian rhythm dysfunction. Her body clock's set a little bit early. And one way to address this is with light therapy, with getting more bright light at night to try and push the circadian rhythm a little bit later. So that you get evening light here in front of you, one of these light boxes, and it pushes your body clock and realigns it with the day-night cycle. So will this prevent dementia? So we have a study ongoing right now with Dr. Manuel Montero Dasso at Western, where we have a bunch of folks at high risk for dementia who are being randomized to either an educational intervention or a more intensive intervention, among which is phototherapy for circadian rhythm disorders. So we hope to get results. This is actively enrolling right now, and we hope to get results in a couple of years' time. And the last little bit for this talk, sleep apnea, will treating sleep apnea help? Any of this? So we just completed a study where we took a bunch of folks with sleep apnea, with relatively severe sleep apnea. All were treated with CPAP, which is a standard treatment for sleep apnea. It's a mask that helps you to breathe at night. And then we did brain imaging and cognitive testing before and after. Some of the people, anybody who's ever used CPAP knows it's not that easy to use, right? And some people are able to use it, some people are not. And what we did, among other things, was take a look at these like holes in the brain. So there's these perivascular spaces that increase in Alzheimer's disease, and there are these channels that play a role, we think, in draining kind of like the toxic materials from your brain. And when they plug up, they kind of get enlarged. So what we found was, and this is a work of one of my students, so what you found was that when you compare people who use CPAP and not, and by use CPAP, I mean use CPAP for at least 4 hours a day for at least 5 days a week. What you found was that the people who didn't use CPAP had further kind of enlargement of these perivascular spaces, so their channels were getting kind of all clogged up, but that this enlargement was arrested in people who were able to use CPAP consistently. So this is kind of early kind of signals that treating sleep apnea is kind of helpful. What happened to memory? So what we found too is that people who use CPAP consistently had a bigger improvement in their memory than people who use CPAP kind of inconsistently, less than 4 hours a night. So what do I see, as the future? So let's say Beatrice has come into my clinic instead of 2024 and 2032, 8 years down the road. So when she's still cognitively well, she comes and sees her family doctor for sleep difficulties. Rather than sending her to a sleep clinic, right? Her family doctor gives her a little cloth headband to wear at night, maybe some stickers to place on her chest, and maybe a wristwatch or something like that. She gets the results almost right away, right? Because of machine learning algorithms, and that suggests that she has advanced sleep phase, as we think, and sleep apnea, and also changes in her brain EEG that suggests that she might have a higher than average risk of developing dementia in the future. So her family doctor then is able to use this sort of AI-guided phototherapy and CPAP for her sleep apnea, and Beatrice's sleep is now much improved without ever having to see me or another or a sleep clinic, and she lives for many, many years as cognitively sharp as always. All right, thanks a lot, guys.